Good evening, everyone. You're all very welcome to this evening's webinar, which is entitled The Man I Am. The webinar has been organised by Mental Health Ireland in collaboration with Men's Health Forum Ireland and Recovery College South East. My name is Bill Vaughan and I'm a Development Officer with Mental Health Ireland. Before we go on, let me just give you some guidance about the housekeeping. Firstly, just to let you know that the webinar is being recorded, but only the panelists will be seen in the recording. During the webinar, you will be able to ask questions by using the Q&A button in the toolbar, and we will be able to put some of these questions to the panel later on. As you may know, we are currently celebrating World Mental Health Week. World Mental Health Day was last Sunday. And this is one of Mental Health Ireland's events celebrating World Mental Health Week. It really is wonderful to see communities all over the country creating different ways to mark the occasion. Coffee mornings, community walks, art competitions, mindfulness meditations, which is encouraging us all just to take some time and reflect on mental health and well-being and how much we are investing in our own mental health and well-being. So our agenda for this evening's webinar. This evening, the focus is on men, and in particular, men's mental health and identity. You will get an overview of current trends and research in Ireland now relating to men's mental health. Then we are going to have a panel discussion with 4 men who all are doing great work in promoting the importance of looking after our mental health. As you will see later, all these men don't just talk the talk. Their passion and creativity has led to them being great ambassadors for the cause, and we are delighted that they were able to join us this evening. So now, to get us underway, I would like to welcome our CEO in Mental Health Ireland, Martin Brogan.
Thanks, Bill. And just to welcome everybody along this evening. And as Bill has said, this is a men's mental health event. And I'm sure there was a great flight of numbers when he said he was going to bring us through the housekeeping, because that's a great way to cause men to break eye contact and disappear and dive in behind the couch somehow. But as Bill has mentioned, World Mental Health Day was Sunday, and this is World Mental Health Week. And there's been many, many activities, lots of conversations about the whole area of promoting positive mental health. How do we care for ourselves? And some of these messages can be quite generic, but Bill had a genius idea a number of weeks ago and said, why don't we have a special event around men's mental health? And let's bring some expertise to bear, and let's bring the men into mental health. Because sometimes these conversations don't happen nearly often enough. And whether it's with a brother, a dad, a son, a colleague, a best mate, a teammate, where do men have conversations about mental health, and how do these conversations happen? And are we ready for this? Do we have the language? Do we have a dialogue? Do we have a comfort? And I think things have moved extraordinarily over the last number of years, where people are much more open on these topics. And I think that's because we can be a lot more hopeful on these topics, because with a better understanding, with a better discussion, things can open up. Sometimes the burden of people feeling low in themselves, perhaps feeling depressed, perhaps feeling anxious, perhaps taking refuge in maybe drugs or alcohol. And sometimes this has been portrayed in the past as being something of a cul-de-sac. And in our work in Mental Health Ireland, we work with people in recovery, and people who've often had the most extraordinarily difficult path and passage in terms of trying to find a way through life, sometimes with consistent traumas and different difficulties in their lives. And they've shown extraordinary courage and resilience to find a way back, to move away from some of the things that might have appeared to offer a short-term solution. So I think tonight is a hopeful event. It'll be a very enjoyable event. There's an excellent panel of speakers. We hope to have a discussion. We really want you to join in with that. We want to make it as interactive as possible. Certainly use the Q&A function there as well. If you have questions for Bill or any member of the panel, drop them in and we'll feed them in. We'll try and get through as many questions as we can. We have over 150 people have already joined us, and we are recording this event. So you can recommend it to mates and it'll be available afterwards. So at Mental Health Ireland, we're really pleased to collaborate with the Men's Health Forum and with Recovery College South East to get the experience of people who are showing extraordinary courage and not necessarily heroics, but balance and resilience and an ability to learn from things that haven't always gone well in their lives and to revisit that, reappraise themselves, reinvent, and step forward into the world again. So I must say, I'm really looking forward to tonight's event, and I'm sure you'll enjoy it too. And please do encourage people to interact with it afterwards. You can watch the recordings, and we will be sending on an evaluation format because we're always trying to improve and encourage these events into the future. Based on your response, we'll organize new events in the coming months as well. So I'm going to pass it back to your host, to Bill, and just say, sit back and enjoy. It'll be a really enjoyable evening.
Thank you very much, Martin. And we'll be covering a lot of the topics later on in our panel discussion that Martin mentioned there, recovery, resilience. So I'm looking forward to that very much. First of all, what I want to do is look at the overview of men's health in Ireland today, just to get a picture about trends that may be happening. Are we getting healthier? Are we coping? How are we coping with today's challenges? Or are we not coping? And I can tell you now that the next man is able to tell us all about this and put us in the picture. He has a keen interest in men's mental health and suicide prevention. His PhD focused on developing evidence-based art interventions to promote mental health among men in areas of social disadvantage in Northern Ireland. He has also explored the mental health experiences of middle-aged men considered at risk of suicide in Ireland, which informed the development of men's mental health training programme called Engage, which is the national programme used by the HSE. He has recently taken up a post as a health promotion officer in the HSE, where he will focus on staff health and well-being and will lead on the development of a new suicide prevention campaign in the Irish construction industry. So I'd like to welcome Dr. Shane O'Donnell.
Thanks very much, Bill. I'm just going to share my slides with you now. So, Bill, you might just let me know if you can see them okay and stuff. Is that okay there?
Yeah, perfect.
Perfect. Go back to the start. Be a good place to start. Yeah, so thanks very much, Bill, for that introduction, and thanks to everyone who's attending the event today, and especially to Mental Health Ireland for inviting me here to give this talk. When I heard the name of this event, The Man I Am, I thought, like, what a great title for the event. There's so much space within that phrase, to reflect on our deficits and our weaknesses, but also our strengths and our positives and the things that are life enhancing in our lives. And it allows us to maybe look back at the man we were, the man we are, and maybe the man that we'd like to become. And how this phrase stands in such stark contrast to some of the phrases that we often hear are associated with men, like be a man or to man up. And these phrases themselves aren't particularly damaging. The words aren't damaging, but they sort of represent and reinforce the way that men should be. And that's to be sort of stoic and invulnerable and emotionally withdrawn. And we sort of know from the research that men who feel that they have to live up to these expectations often have negative mental health outcomes. So I suppose for me, that's really the essence of men's health. And today for this webinar is trying to challenge those expectations of how men feel that they should behave or are expected to act, and to move into that more freeing space of the man I am. So really, I'm just going to set the context of what is men's health today, and with particular focus on men's mental health. So what is men's health, or why should we focus on it? Well, the World Health Organization defines health as a state of complete physical and mental well-being, and it's not merely just the absence of disease. And I think we think about our physical health in this way, you know, if you look at this continuum, if we're in the red with our physical health, we might go to the doctor, or we might take medication, or if we're in the blue, sometimes we think, right, I'm feeling good, but you know, I could do a bit extra, more sleep, I could drink more water. But when we think about our mental health, we tend to not think about it until we're in the orange or the red, until something's wrong. And that's just one point I wanted to make, is that we need to reflect on the things that are life enhancing to our mental health and schedule them into our routine, just as we would our physical health. Even if we're in the blue or the green, how do we stay in that good place we're in? So why focus on men? Well, I suppose globally the male life expectancy is about 6 years lower than females, and it's 5.4 across the EU. And this is largely because of diseases that are largely preventable and associated with lifestyle and behavior factors. So certain types of cancers, cardiovascular diseases, accidents, and unfortunately suicides. But the good news here is that they're largely preventable. And so we can do something about this. And men in Ireland are doing something about this. And it's slightly, that gap is slightly lower between men and women in Ireland, and has reduced over the last number of years as well. So, but why is this going on? Like, what is it that's affecting men that they have a lower life expectancy? Well, there is some evidence that's related to genetic and biological factors, but a lot of it has to do with lifestyle and behavioral factors. So these two words often get used interchangeably or get mixed up, but I just wanted to make the distinction here. Sex relates to our chromosomes, our reproductive organs, and our hormones, so male or female, whereas gender relates to the roles, behaviors, and attitudes that's associated with sex. So sex would be male, but the gender would be masculinities, and how men feel that they have to behave or are expected to behave, act, talk, and walk, and that sort of stuff. So how does this affect mental health then? Well, really, you know, what are some of the traits that men feel they have to be like? Well, it's often to be the breadwinner, to be self-reliant, emotionally withdrawn, and to be the provider for the family, to have certain jobs, to be physically strong, you know, drink alcohol. And really, it's quite a limited sort of frame that we feel we have to fit into. And what happens for many men, and men are also different, who feel that they can't fit this frame. They often feel that they fail as a provider, fail as a husband, and often fail as a man. And it also leaves us with a sort of limited set of tools to respond to the stress when this is all that we have. And this is from some of my research, and I'm not going to go into this in depth, but just from across a number of years of doing research, these are sort of the common themes that come up. And the first one there, I suppose the thing is to say as well, apart from sort of childhood adversities and stuff like this, these are the common things that come up. So, you know, failure to meet expectations, you know, as a man, so it be that failure to provide, or failure to have the job, or failure to have the things that they thought they should have in life as a man. And just this quote from Arnold here, I think sums that up really well. As a man, you're given the roles that you're expected to play. You work, you marry, you have kids, and outside of that, it's the pub and the bookies. But what if we don't or can't fulfill these expectations? I have failed as a man. I had to understand what tools and opportunities I was given to achieve those expectations and what I wanted for myself. And the next one there is isolation and loneliness. So a lot of men say that from their kind of 30s onwards, they start, you know, they're a lot more into their job and things get a lot busier, and maybe they have a partner, and, you know, the social connections start to narrow from that age group. So as men get older, they start tending to find that they're starting to get a little bit isolated. And particularly with groups who are more marginalized, who face discrimination, often talk then about being discriminated against or rejected from social settings as well. So that's sort of another added layer there. And then we know that men often withdraw from social scenarios if they do experience mental health difficulties, so they don't feel, or that other people won't find out that maybe they're having some mental health difficulties. And then the other thing is around help seeking and maladaptive coping. So if men should be invulnerable or emotionally withdrawn, what happens when men do need help? Well, they feel a sense of failure, again, if they do seek help, that they weren't able to manage on their own, or they couldn't live up to that sort of masculine way that they should be, often then coping through things like alcohol, which could be seen as a more manly way of coping, but that can also contribute to more distress. So what are some of the facts then around men and mental health? Well, unfortunately, when we talk about men and mental health, we end up talking about men and suicide. So females have higher rates of anxiety and depression, but the male suicide rate is 3 to 4 times higher than women. And that doesn't mean that men don't have anxiety or depression, but it's often that they don't get diagnosed with depression because they have different symptoms, or that they're not presenting to the doctor. So there is some ongoing research at the moment of developing a new sort of scale to diagnose men with male type depression. So we know that men are more likely to present with anger or irritability or increased alcohol use rather than feelings of low mood. So I suppose within Ireland, then the high suicide rates are amongst middle-aged men, 40 to 59. So and a lot of the attention is on kind of younger men, and it's actually a lot of the suicide rates are highest amongst middle-aged men, and again, more marginalized groups, more at risk there. So I think that really ties in with the theme of World Mental Health Day, which was around inequalities and access to mental health services. So we need to be conscious of that within groups as well. The suicide rates between 2008 and 2012 increased significantly, and the female rate during that time remained largely unchanged, but this was predominantly due to the male suicide rate increasing. And this was at the time of the economic recession and unemployment. So we know that they're associated as well. But I suppose some good news from 2013 to 2020, the suicide rate has reduced year on year, and it's now its lowest in 20 years. I know there were some kind of myths and stuff last year that suicide rates were really, really high during COVID, but at the moment the data doesn't really say that. But we need to remain vigilant of the ongoing impacts of COVID on our mental health nonetheless. I suppose what is going on in Ireland, or like what are we doing about this in relation to men and mental health? Well, I suppose we're in a lucky position in Ireland that Ireland was the first country in the world to have a men's health policy, and this really underpins a lot of the work that has been done in Ireland to try and support the mental health and health more generally of men. And this has largely been driven by the Men's Health Forum in Ireland. So in partnership with the HSE and the National Centre for Men's Health Research in IT Carlow. So I suppose the first thing that the Men's Health Forum in Ireland do is around raising awareness. So we need to raise the awareness around men's health issues. So you might be aware of Men's Health Week that runs every year. It finishes on the Father's Day in June each year. And really the point of this is just as I said, there's to raise the issues of men's health. And I suppose to promote men's health as well. So if we raise the awareness, then we also need an evidence base. So that's another, I suppose, thing that the Men's Health Forum do is engage in research and try and produce evidence. So as you can see on the bottom there, a number of reports that are all available on the Men's Health Forum in Ireland website if you would like to check those out. And the most recent one there being Men's Health in Numbers, which kind of shows a number of key health indicators and how they have either improved or worsened over the last 20 years. So if we've developed an evidence base, what do we do then? Well, we also produce training. So that's what Engage training is. So it's a national training platform that's delivered to service providers in association with the HSE to train service providers how to better engage with men around mental health. So we have a number of modules on that. Some are generic, some are specifically on young men, one specifically on middle-aged men, and there's a new one that's specifically for farmers as well. So I suppose when we develop these resources, another important part then of the Men's Health Forum in Ireland's work is around inter-agency partnership work. And so, you know, all the members, apart from one member, all the members of the Men's Health Forum are volunteers. So we all work together and work with different organisations to try and promote men's health across Ireland. But it's not just us as well. There's a number of great initiatives in Ireland that relate to men's health, which many I'm sure you'd be aware of. So the Men's Shed movement and their Sheds for Life programme. We have Men on the Move, We have organizations like the Men's Development Network, Pavy Point with their own men's health stuff. We have the National Centre for Men's Health Research as well, and then organizations like the Irish Heart Foundation and Mary Keaton doing their own sort of men's health campaign. So we're in a really good place there. So I suppose if you're maybe not feeling the best, what's in your mental fitness toolkit? What can you use? So I heard a really good phrase by Tony Bates on the radio the other day, and he said, sometimes we need to walk and sometimes we need to talk. And I just thought that was a really good way of putting it. You know, and sometimes we need to reach into our mental fitness toolkit and maybe pick out some of these tools. So, you know, sometimes it might be doing something. It could be going for the walk. It could be our interests or hobbies. It could be connecting with others. And sometimes we also need to talk and open up to people as well. And I'd encourage you to check out the Minding Your Wellbeing series on the HSE Health and Wellbeing YouTube channel. So there's 6 videos that are about 20 minutes each. And they're really a great tool around how to sort of better mind yourself and your mental fitness and mental well-being. But what if there's a man in your life that you're that you know is struggling, but you're sort of unsure how to bridge that conversation? Well, this is from the Movember Foundation, who came up with this acronym called ALEC. So to ask, listen, encourage action, and to check back in. So, you know, start off by asking how he's feeling and mention any changes you've noticed. So, you know, don't be afraid to approach the conversation. Like, I've noticed that, you know, you haven't been yourself lately. Is everything okay? And you might get that reaction, oh yeah, everything's fine. But just, you know, just to be sure, ask twice. And they might say fine again, and that's okay. But just let them know, you know, if you ever want to talk about it, the offer's always there. And then if they do open up, you know, listen. So really, you know, actively listen. Don't be on your phone or looking around. Pay attention to what they're saying and ask questions to show you're listening. You know, so when did this start happening? That must be very hard. How did that come about? To be empathetic, you know, defer judgment as well, and don't try to jump in and diagnose problems or offer solutions. So it's often useful to kind of just listen and to ask the person, like, would you like some advice on this, or would you like me to just listen? And then to encourage action as well. So to focus on the small things that you could change to improve their situation or mood. So asking them, you know, is there anything that's worked in the past? You know, you might highlight some of those things that were in the mental fitness toolkit that I just highlighted earlier, and encourage them to share with a trusted individual. And I suppose this sort of minds you that you're not the only one that knows about, but also it starts to widen that social network that person feels they have as well. And also to signpost to professional services. So I suppose just to have an awareness of some of the services in your area is always useful as well. And then to check back in. So not to just let that conversation happen and never return to it again. So the next time you see him, you might go, you know, how is everything? They might want to talk and they might not, but just to offer that chance to check back in and not to kind of leave it hanging there. So I suppose that's really where I wanted to round up there, just to set the scene. Well, I suppose a bit of a call to action. If you think back to that continuum that I showed at the start, and if you think about that on a scale of 0 to 10, at the moment, where would you put yourself on that scale? And then to think about that mental fitness toolkit. If you're a 5, how would you get to a 6? Would any of those things happen? So if you're to make one change to better support your own mental health over the next day or month or year even, what would that be, and what difference might it make to your life? And as well, if you're to make one change to yourself, your actions, behaviors, or beliefs to better support men's health, what would that be? What difference would that make to your home environment, work environment, or your life in general? Because really, men's health is everybody's business. We all, if we're not a man, we all have brothers, we have fathers, we might have partners or friends, you know, and it's not that we're trying to change the whole essence of what it means to be a man. It's actually quite the opposite. It's encouraging men to feel comfortable with all aspects of themselves, to love and care for other people, and to be the man I am. So I think I'll leave it there, and thanks very much for listening.
Shane, thanks very much. That was fantastic. Maybe if I could ask you, Shane, to come back on. Great, thanks. I really found that there was so much to take in there. Just some of the things that kind of resonated with me. You mentioned about we were, we are, and we become. And so, do we ever really know what it's like to be a man if we're changing all the time? That's what that's what I was kind of thinking when I saw that there. Living up to expectations, and fitting the frame. The pressure that some people can be under, and again that changes with each generation. I'm not sure now what the next generation of men, what frame they feel if they try to fit into. So there's kind of change there as well. That was interesting. The issues impacting on men, the expectations, failure to live up to expectations, the seeking help, difficulty seeking help, and loneliness. It was the first time I saw those three coming out together, which is very interesting. And then the suicide. It's interesting that we may look at the general suicide rates and think, oh, suicide rates are coming down. That's great. But then if you look, at certain bands of men, middle-aged men, or minority groups. One I can think of is traveller men's groups.
Yeah, exactly.
It's that you find a different story. So thanks very much. There was a lot of work putting that together, I'm sure, and it was done in such an interesting way. I find it hard retaining stats, but that was just very, very interesting. Thanks very much, Shane.
Thanks, Bill.
Before we go on, I know like you're open enough to kind of say, Shane, about you've had your own struggles. Do you want to just briefly mention that before I introduce the rest of the panelists?
Yeah, I suppose. Yeah, I suppose I would have had anxiety or felt anxious from a very young age, and still do. So a bit nervous given the presentation, but glad to be doing it as well. But yeah, I suppose from starting to study the area, it allowed me to reflect and go, actually put a name on it. God, I was anxious from a very young age. I was going and seeking help for it, but I didn't really know what was wrong with me, and I never really fully reflected on it or gave time to it and thought, like, why am I feeling like this? Why have I not talked about it before? So I suppose starting to learn more about mental health and have a bit of an education around it really helped me to sort of see where I was, and maybe the man I was and the man I wanted to become as well. Do you know what I mean? So I suppose when I'm talking about that transition as well, I am probably talking about myself. And I think sometimes when we talk about mental health or as researchers or anything, there's a part of us in that, there's a part of everyone in that story.
I think you hit the nail on the head. It's kind of like a lot of the times I find it's the struggle, it's a personal struggle that gets a person interested in the whole mental health area, and the field.
Yeah, and I think that adds to the field. And I don't want to talk about the field, but it allows people to understand what it's like to maybe not feel so well as well.
Yeah, well, Shane, thanks a million. I'm sure everyone appreciated the talk as much as I did. And I'll ask you just to stay with us because you agreed to stay for the panel, so I'm delighted about that. And what we'll do now is go on and I'll introduce the other three guests. So the first of the guests went to university to study intricacies of human behaviour. Since then, he became a consultant to some of Ireland's top corporations. He's a final year PhD student, a lecturer in Trinity College and University College Dublin, a life change strategist, a radio presenter, and author of his recently published memoir, Bonus Time. Welcome to Brian Pennie.
Hi, Bill. Thanks a lot. What a brilliant presentation, Shane. I thought it was absolutely brilliant. Thanks for that, and delighted to be here. So I'll just add a little bit to that introduction. Thanks for the introduction, Bill. So before I went back to college, so I'm actually 8 years clean I'm in recovery from heroin addiction. So I was a heroin addict for 15 years, and I'll be touching on that, I'm sure, in the discussion, but addiction was never my problem, really. Anxiety was my problem. I was tormented by my mind, consumed by anxiety, and I just lived in a spiral for many, many years. So I found recovery in 2008, in 2013. And as Bill mentioned, I went on to study, and really I became intensely curious about the human mind. And that's a journey I've been on. I've gone on to create what I call a program for life, and I share these tools with as many people as I can. So that's me in a nutshell. Great to be here, as I said already. Thanks.
Brilliant. And I'm looking forward to maybe touching on some of those points later on, Brian. And thanks a million for sharing that and joining us.
Cheers, Bill.
Okay. Our next guest is a digital and creative manager for an advertising agency. That's his day job. Through his own mental health challenges and his love of sport, he has created a successful podcast called The Endless Spiral, where he has interviewed all sorts of interesting people, including athletes, journalists, and entertainers. Welcome to Keith Russell. Hello, Keith.
Bill. Hi, Bill.
How are you doing?
I'm good. Thanks very much for that introduction. I'm delighted to be here as well. So I'll just kind of give a few more points to myself that Bill gave there. So yeah, obviously I'm the creator and founder of The Endless Spiral, which is a mental health podcast and blogging platform for people to share their stories. And I think what inspired me to set that up was that I've lived with mental health myself for such a long time. And as Shane was saying in his presentation about men just not being diagnosed, I was one of them. You know, you sweep things under the rug and you just don't talk. So during COVID, I just decided I was going to change my life, and I was going to start sharing my story and help other people share their stories. So that's what I've been doing during COVID. I've been very, very, very busy doing that. But I have to say, like, I've been completely blown away and overwhelmed by so many men contacting me. And I have to say, I think men are the untold stories with mental health and so many different conditions. So hopefully, this webinar tonight will give people a bit of an insight into our own stories, but a little bit of an insight into maybe where things are at the moment, and hopefully where things can improve.
Brilliant. Well said. Thanks, Keith. And our final guest is also a man who likes his sport and could be found in his local boxing club as a young fella. He has been working with Mental Health Ireland for the past 2 years. His role is lead peer educator with the Recovery College South East, where he co-produces and co-delivers recovery education within mental health services. He has a master's in social research and is interested in the different ways people look after their health and well-being. Welcome to David Dwyer.
Thanks, Bill. Hi, everyone. You're very welcome. Welcome to all our participants tonight. It's great to be here to contribute to this event around men's health. Really great listening to Shane's presentation there. Catches me all the time just talking about, the different masculinities, living up to different expectations and stuff like that. So really good to be part of this. I suppose a little bit about myself then, of a lived experience. Actually, prior to working in the Recovery College, I worked in addiction services for a good few years, and I'd have a lived experience of addiction. 2002, I found recovery. Took me a few years to shake off, the effects of addiction and to get clean. So I think I'm clean now since around 2006. And I found the journey really interesting in that kind of exploring life with an open mind, and loosening the kind of masculinity shackles that we find ourselves under from time to time. So really looking forward to the evening ahead. Thanks.
Great. Thanks, David. You're lucky enough in that you're working in the field of mental health as a job, so that must be good. Working in something you're passionate about.
Well, it's fantastic, really, when you get a chance to kind of influence change within the services, within individual lives. And also from that, I get from that as well, because I learn from people as well. If recovery or life has taught me anything, it's to remain open, and the day I think I have it all licked will be the day, that
That's the day you're in bother. You go down the ladder. I'll go down the snake.
Yeah.
Okay, well, lads, thanks very much for adding to that introduction. And what's great about that is you've all kind of shown the underbelly side, the frail side, which it's in us all, I think, and it can be so difficult for men to kind of share that and talk about that kind of thing. So hopefully we'll continue that in the discussion that we're going to have together. The format will be that I have some question here just to kind of get some of the conversations going. So I might direct the questions at one of you, or I'll just might leave it open, and then that person can answer. And once they've finished, if anyone else has anything they would like to add, feel free to jump in and add your penny's worth. I know there's a huge interest in the webinar, so don't forget, everyone, that you can use the Q&A if you want to ask any of the panel any questions, and we can ask some of them later on. So to begin with, maybe Brian, if I could ask you the question. We see from your story that change is definitely possible. Could you say a wee bit more about that change that you went through?
Yeah, I sure can, Bill. And for me, that's really my mantra. It's around change is possible, and incredible change is possible if you're consistent within that as well. Well, as a starting point, which I mentioned already, like I was crippled with anxiety and fear and overwhelm as a kid, an overactive mind. I was always worried. And that's my big memory. That's my main memory as a kid growing up. And really, as I grew up, I grew up in I suppose a disadvantaged area, an area with a lot of violence, a lot of drugs, and there was a belief that I had, and it really comes back to what Shane was talking about, that don't show weakness. That's a belief I had. I cannot show weakness. Don't express your feelings, and that kind of developed. And as somebody that was crippled with anxiety, that couldn't show weakness and couldn't express my feelings, I spiraled into a world of drug addiction because it's the only thing I knew. It was like an anesthetic for my anxiety. And as I went on from that, it was just, for me, it was this inability to cope. I just says, I can't cope with life. And something that Shane mentioned early on is really had to resonate with me. I believed I failed as a man, as a human being, and failed as a man. And that's really the position I was in. And as I mentioned, I was in heroin addiction for 15 years. But I was very lucky to find recovery at the age of 35. And what I learned on that journey was that our beliefs are based on our internal narrative and the statements and the judgments we make about the world. Mine was that I cannot cope. I was very lucky to have a perspective shift in 2013, which I can only describe as my mind went really quiet. And when my mind went really quiet, it was like all of these negative emotions left me. Now, I went on a journey after that. I became intensely curious and interested in academia and personal growth and the human mind. And I've since learned that language is a vehicle for emotions. There's a quote I love: the words we speak become the house we live in. So I was no longer trapped by these beliefs. So what it was, basically, I changed my thoughts and beliefs. With that, I changed my emotions, and the research backs this up. And when I changed my emotions, I was able to change how I brought myself and acted in the world. So what I will say, that's where the change came for me. I changed my internal world, and when I changed my internal world, I could change my external world. And today I can talk about my feelings. I can express vulnerability. Vulnerability for me is a strength. And that would really be the core component of how change for me was possible. And I believe how it can be possible for other people as well.
And could I ask, when you say you changed your inner world, I'm sure there's a lot of men listening that'll be saying, right, well, how could I, how do I go about doing the same thing?
Yeah, but really important question. And the idea is, like, to change our beliefs. It's basically our beliefs determine the consequences. So if you believe you can't cope with a situation, you're going to get anxious about it. But if you believe, right, I mightn't do well in this situation, but I've coped with other things before. But what's the worst that can happen? If that's your belief, all of a sudden the consequences change and how you feel about that change. So what I would say to someone in a nutshell, we've only a few minutes here, would be to actually stress test your beliefs, dispute your beliefs, challenge your beliefs. If your belief is, I'm no good at anything, I'm always a failure, well, challenge them beliefs. Have you always failed at anything? Is that actually true? Because the chances are this isn't completely true, isn't entirely true. And we can all develop a growth mindset. Like when I went back to college, I was really struggling at the start. But as I mentioned at the very start as well, change is possible, but huge change is possible with consistent steps. Baby steps, but consistent steps that compound over time. And when you start the work, start small to keep yourself motivated. That's where change really happens for me.
Yeah, that ties in a wee bit, just on picking up on something Shane said about daily maintenance of your mental health.
Yes.
You know, so change is, you know, to change, you know, you're undoing habits of negative habits that are there for ages.
Definitely, like it's behavioral reinforcement, and you could be changing years of that, and biologically you're changing your brain structure as well, like on a neural level as well. So consistency got you there, so you have to get it over with consistency as well. But baby steps, just keep going and believe in the process.
Yeah, for sure. Just to add on that, Bill, it's like, you know, it's like if you were going to start playing hurling now or something, you're not going to be taking sideline cuts the first time you start playing. You know, you're going to have to start somewhere and learn the basics. And it's the same when you're, you know, oh, I'm going to be more open. You're not going to go from being closed off to being open like overnight. It's, you know, you're going to have to try, and it'll be hard, but change is possible, like Brian was saying.
Yeah.
It was like that for me as well, if we can jump in there, you know, but it was much slower than that. The internal kind of exploration and stuff just wasn't available to me in the first, even I'd say, a few years of recovery. And I just had to put my faith in other people and see that it was working for them, like that they were changing. It was too painful to look inwards for me, you know, and it took a long time to be able to do that. And I suppose that was my reason for using drugs, perhaps, was just to anesthetize and to blank out all that pain, the trauma, and can really identify with Brian's early days there around not being able to show weakness. And you know, I was a boxer, I was in the boxing club. It's what happened to us here in the Southeast for the working class families, like, you know, you're thrown into the boxing club and stuff like that. And I had butterflies before every spar, before every fight. I just wasn't able to say that, you know, and you kind of contain that. It's almost like a pressure cooker, you know, it's like hiding part of yourself. You know, and that continued on into teens as well. And, you know, so really good just listening to Brian there and really relate to that stuff. So, but there is freedom from it. And I suppose we're all living examples of that. Even today, like I had a bit of anxiety came up about this evening and stuff. And, you know, I was trying this, that, and the other. I tried some meditation. It just wasn't able to sit still. So had something else in the toolbox that Shane referred to, you know, I went for a walk. My body needed movement. So, you know, it's whatever it takes, like, you know, but,
If I could just add something very quickly, because we're probably pushed for time, but something I didn't mention.
We're okay with time. We're good on time, Gate. Yeah.
Something that I didn't mention in my own intro is what I actually have been living with for a long, long time in mental health. And I've lived with anxiety, depression, body dysmorphia, which we'll talk about later on, and an eating disorder. And just as what Brian was saying and what Shane was alluding to in his presentation about failing as a man, I mean, I suffered from that for a long time. I mean, I changed careers in my early 30s, and it took me quite a long time to get my head around that and to go out in, you know, in the world and actually stand on my own 2 feet. And from 2009 to 2014, I practically done nothing, even though I wanted to do something, because I was frozen with fear of going out there. But I mean, like when I look back now, I mean, you know, I suppose everything happens for a reason, but at the time you don't think like that. But when I look back now, if I hadn't taken certain steps, if I hadn't done certain things and I pushed through that anxiety and pushed through that fear, I wouldn't be where I am today. And I probably wouldn't be able to cope with my Wi-Fi collapsing 2 minutes before this webinar started. You know, like I'm here and I'm fine, and like nothing, you know, catastrophic happened, where before you know, when you're in the anxiety kind of headspace, you feel like the world is coming to an end, you know.
And were you able, like you talked about there, Keith, being frozen with fear. Were you able to kind of conceal that fear from the people around you? Like, I know probably the boys talked about addictions there. It's harder the worse it gets, obviously, with addiction to hide that. But when when it's just the kind of anxiety, but the anxiety gets so out of hand, how did you manage that?
I had say the body dysmorphia and eating disorder for 20 years, but for the anxiety, which the body dysmorphia caused the anxiety, but I think I hid the anxiety pretty well, but I probably didn't. Like there's some part of the anxiety I hid, but as the anxiety progressed, I certainly didn't hide it very well. I remember having episodes where I just felt very overwhelmed, and I have to admit, and I'm quite able to admit now, I didn't handle it very well, and I got quite emotional in certain things. So yeah, to answer your question, I didn't handle it very well at the time. So I think now I've learned some tools, and I've learned a lot about myself and listening to other people tell their stories. Hopefully I'm in a much better headspace now where I can deal with those things now. But at the time, no, I didn't cope very well at all.
Yeah. It's just I would have had a wild bother with anxiety, and I remember going to group therapy. First time I ever went to group therapy in London, and I couldn't get over when I heard 10 other people in the rooms talking about what they're experiencing and what they're feeling. I thought that was the first time in my life I realized, God, other people feel exactly how I'm feeling. And that in itself was the start of kind of realizing this is a bigger problem than just me,
I think, Bill, that starts to bring the walls down as well, though. When you feel it's not just me, then you go, hold on a minute, like I'm not the odd one out here, like other people feel like this, so surely it's not just me. There's nothing wrong with me. It's, this is a normal response to things that happen.
Yeah. And would you find, any of you, just on that there, would you find now that you're all obviously comfortable about sharing a bit about your past and struggles with mental health, do you find now that people tend to nearly kind of go to you with their anxiety, with their anxieties, and that, knowing that you're someone who's open about it?
Yeah.
I think people are more willing to share that, all right. Especially they feel more safe, perhaps is the word. And especially if you're revealing a piece about yourself, or being open about your own experience of stress, anxiety, or whatever it might be. For sure, people feel at ease, I guess. And I suppose people are looking for answers as well as how to manage this, or how do you do it, so really people want kind of ways of managing that. That's what I find anyway. And who better to turn to than someone who experiences, because I suppose the connection you feel to someone, if they share something in their story or their narrative, and it sounds like they're actually talking about your experience, like you can't get a deeper connection really with someone, so it's certainly makes people puts people at ease anyway. And
and even if it's not that initial, you might talk to them about your own struggles, and them might go, oh yeah, and they might not say anything, but 2 months later or 3 months later, they might say, do you know that time you were talking about this, so like sometimes you're just sowing seeds as well. Not that you're trying to, but if you're just open about it, I think it's important that we all are, because it's kind of that one drop in the ocean kind of thing. Like if all of us are more open about it, it starts to change the social norms kind of thing, and it makes it easier for everyone.
You don't know where it's landing. And something good might come of it. There's a couple, when I go to the gym in an informal way, you'd find a few burly lads that come up to you on their own now, never in amongst other men. We don't do things that way, but and
that's not the male way.
But
not yet, Bill, not yet.
Okay.
We're getting there. We're getting there.
I get so many questions and messages through my social media from men contacting me because I've been so open about topics that men just don't discuss. And I've had, like I said, I've had so many questions, but I think a lot of people just want a little bit of support. I mean, you'd be amazed what something small can have a large impact on someone else. Do you know what I mean? Like even yesterday, I had a message from a guy, and he just felt alone, and he wasn't feeling very well. And the fact that I just responded to him, he couldn't believe it. That, like he said, like, I'm a stranger, and he said, you've asked me more questions in those few minutes than other people have asked him, like, in such a long time. You know, so you'd be amazed how just a small gesture can have a large impact on someone else.
And when you think then that one of the big issues with men and mental health is loneliness.
Yeah.
You know, and that how you know, just connection, just talking is it's free, and it's so valuable. But you know, lifestyles is with televisions, you know, people working, coming home tired, television on. Sometimes it's hard to get a chance to talk at all. You know, we're too tired.
Yeah.
So I'll go on to the next question, and I'll direct this to David, and then we can all pile in after. David, how do you think that your life experience has helped others?
Thanks, Bill. So I suppose we've kind of touched on it already. We've talked about the whole concept of narrative and telling your story and stuff. I suppose I'm lucky enough to work in a job in a professional setting that draws on my experience. It draws on the lived experience. And, you know, for too long now, people's lived experience of anxiety or mental health challenges or addiction or all of those things has been kind of pushed under the carpet and not acknowledged as a source of information, as a source of knowledge. So thankfully things are changing, maybe slow, but certainly things are changing. So, and those forms of knowledge I refer to are the lived experience, the kind of professional knowledge, knowledge that family members bring to the picture as well, you know, invaluable source of knowledge, and also community services as well. So the recovery education we produce includes all of those perspectives. So in that sense, the lived experience, you know, recovery education has been proven to be a valuable source of support for people in informing them about how best to manage a certain mental health challenge or whatever. But also, I suppose, when I first came to recovery, perhaps the options weren't as wide as they are now, but it was Narcotics Anonymous was what I stumbled into. And part of that is that you give back what you got, like, you know, and obviously you get yourself right first, and you know, you don't kind of go helping others when you haven't really helped yourself and stuff, like, you know, so yeah. Stabilizing yourself first of all, getting well in yourself. So and part of that then is just telling we call it experience, strength and hope. And, you know, and the reason I believe in that so much is because that's what worked for me at the start. Like, you know, I heard people's stories and I definitely thought that, like, recovery was beyond, it wasn't achievable for me, but I could see it in them. Like, I could see how their lives had changed just through telling their lived experience. And that gave me hope. Like, straight away, I was able to connect with that. You know, I was able to instill a little piece of hope, little by little. It also touched on my identity. I could see parts of my story and what they were saying. So I really believe in that. So any opportunity I get, I give my narrative and my lived experience freely. I've worked in addiction services. I've worked in community development projects. I've worked with young men on youth diversion projects. I'm always willing just to share that. I know what it's like to be, you know, to be bound by that kind of man's man stuff. Like, you know what I mean? No emotions, completely, what's the word? Don't need anybody, like, not dependable and not dependent on anyone. And of course, that's not the truth. Like, you know, I'm a human, so I need people. I have emotions and stuff like that. For too long, I wasn't able to say that. So I think by sharing stuff like that, it resonates with people, and it just brings people to life, like, and it gives them kind of some sort of an insight into a different way, you know, a more gentle way. Yeah. I can remember being really studious starting off school, And then things changed. I wasn't, expressing how I felt and stuff was kind of shut down. And, I'm really committed to helping men along that path, that we don't have to be bound by that and life can be fuller. So, yeah.
I could just hear role modeling the whole way through when you were talking there.
Some role modeling, yeah. I guess I was into treatment 3 times, and it just wasn't working. It was too structured, it was too rigid. I eventually got into a long-term residential addiction treatment centre, and I stayed there for about 18 months. And it was the first time in my life that I was kind of exposed to a gentler type male role model, and really opened my eyes, and in fact, when I got there, I remember saying to the guy, Ger was his name, had a profound effect on my life. And I said, Ger, I come with a lot of baggage. I was I owed a lot of money for drugs. I was kind of down to 9 stone weight. I was a very sick person, and he said to me, that's a requirement for here, and he said it in a real fun way, and straight away he put me at ease, and just little positive risks he took with me, at that time. And other significant people in my life as well at that time as well, both men and women, but I just think by sharing our story, our lived experience, it creates that connection that's really deep, and so.
Well said. Anyone else want to come in there?
Yeah, I'd love to jump in there on that, Bill. I love that, David. And do you know what's really ringing true from David's story there? And I think it's ringing true for all of us tonight. It's this idea of connection, and loneliness has come up a few times. And there's a line by a guy, Johann Hari, his name. He's a great writer, writes on addiction and mental health and connection and stuff like that. And he says that sobriety is not the opposite of addiction. Connection is. But I believe connection is the opposite of much human suffering. We're never more alone than when we're suffering, even if we're in a group of other people. So I just think it's really important. I had the help of my family and friends when I got clean. Dave had the help of loved ones and support and stuff like that. So it's, and Keith talking to them men as well, that just wanted to reach out, just wanted to connect with someone and relate with someone. So I think connection is the key. That's just something that comes up for me again and again and again. It's just the importance of other people in our lives, because no person, no man is an island. We all, and we're social animals. We need to connect. So a message I'd have for anyone out there, I was looking at a few of the questions coming through, is reach out to people, give it a shot. People are actually nicer than you think if you give them half a chance. That's been my experience.
Brilliant. Yeah, definitely. I would agree with that fully. And it can be hard to do. But it's really the kind of the best thing that's going to help when you're in the throes of anxiety or addiction or whatever it is.
Yeah, if I just add something quick onto what Brian is saying there, what you're saying as well, Bill, about the loneliness. I actually got asked that question yesterday from someone, and I hadn't really spoken about it before that, because I'd never really thought about it. But for a long time, I felt very lonely. Very, very lonely and very isolated, because I hid everything. I didn't, I suppose what most men, or maybe not most, a lot of men do when they're struggling with something, you sweep it under the rug. As Shane was saying in his presentation about having to feel like you're the breadwinner and you're masculine and all these type of things, and and as Brian was saying as well about showing weakness. So you sweep it under the rug, and I didn't share pretty much anything for a long, long time, and I felt very, very lonely, and it's a terrible place to be. But as soon as I started sharing my story, I've never felt a better connection to people in my life. I like people that I drifted away from. I've come back again. I've open dialogue with so many people. My social media channels are never quiet, because I'm constantly getting asked questions or people asking to come on the podcast or whatever, but it's all positive. And I certainly am not alone anymore. And I realized since I started sharing my story that you don't have to be alone. As you said, Bill, so many people have similar traits and similar stories, and that can, when you start talking to someone, you wouldn't believe the connection you can have with somebody,
Yeah, Yeah. Well, definitely all of you are examples of how your lived experience has helped and is continually helping people with what you're doing, both in your work and just simply as role models. I'll go on now just to Shane, if I ask you this question. Does society need to change in any way with regards what we're talking about here to help men and grow in their identity, in their just in their lives in general?
Yeah, I suppose it's hard to, I suppose, define society in a way, but like it's, I suppose all levels of society need to change, I suppose. And like what I was saying at the start about our interactions, well actually it starts within yourself, like your own beliefs about men and masculinity, and changing your own expectations of how you should be. You need to change within yourself, and also in your interactions with other people. Like a small child might fall over and you think nothing of it, saying, come on, don't cry, big boys don't cry, but you're starting at that's such a small age. And it's even those things to stop that, and then in our interactions with each other, moving on to like institutions, like, like large corporations, employment practices, like all these masculine things get embedded in them, and they just keep feeding back down through society. So it starts within yourself, but then when we have that confidence, it starts with other people, and we need to keep challenging that. And as I was saying, like, this is everybody's business, because these kind of ideas of the way men should be is affecting men's mental health, but it's affecting women's mental health, it's affecting children's mental health. Like, it's this kind of concept that's not really benefiting many people. And it's not that some of those traits are all bad. Sometimes we need to be stoic. We might need a moment where we need to be stoic, and that's okay, but that's not a tool for everything. So it's we're not changing men. We're not saying, oh, you are wrong and you need to be this. It's not. It's just allowing more freedom within it. So yeah.
And it's a kind of, it's organic in a way, in that there's you said it yourself, there's so much involved. What do I mean when we say society? So I think one thing coming out of your talk about how Ireland at least is at the forefront, recognizing that men's health needs to be kind of highlighted and have a strategy of its own, which is fantastic.
Yeah, of course, and policies and training, and it's a real all of society kind of approach.
Yeah, and I know the Engage training around the country is brilliant too, because it's training health workers to how to work with men, and all these areas that we're talking about tonight. So that's got to be good.
Yeah, no, it really is, and it evaluates quite well. And I was just at a training the last 2 days for Engage, as well, and people seem to get a lot from it. Just to even be aware of that, like, what's your service look like when a man comes in? You often go into a GP surgery and it's women's magazines. It's the only ones that are on the things. It's just small things like that. Just to be. How can we? Yeah.
David, did you want to come in there?
Just briefly, I think it's great to be part of the change, and I think some of the stuff Shane was saying there, I absolutely love the fact my son, he's 8 years old, Rory, and if sometimes he might be afraid to go upstairs on his own, or he might need to cry about something. I'm so happy, that I'm not bound by some sort of thing, boys don't cry, Rory, be a man. That stuff, like, it's beautiful, like, and I'm really grateful, like, that my mind has been open to that stuff, and I've stepped outside of that gender stereotype. But also as well, it's great to be involved in. I love trying to make little changes. I recently met a guy there. I would have done a bit of weight training with him and stuff like that. And I met him in the lockdown, and he said, "What are you doing to keep in shape?" And I said, "I've started some yoga," and his whole face kind of distorted. He didn't know how to respond to me, like. And there is a little bit of, is my manhood on trial here, I'd be thinking, like, but at the same time, I love that kind of, because there's freedom in it, like, I think when you hear other men talking that way, you can be free yourself then as well. So just that's what came up there as I was listening.
Yeah. It's like there's good healthy banter, and then there's banter where you just get a gut feeling that no, this is just hiding something deeper.
Yeah.
You know, where they're avoiding something to talk. Yeah, sometimes you get that there, but that sounds like good healthy banter. The yoga. He didn't come along with it. Okay, anyone else want to come in there? No, we'll move on. The next one is for Keith, if that's okay. Keith, have you ever faced prejudice or stereotype in your life? And if you did, how did you handle these?
Yeah, well, apologies, my Wi-Fi has a mind of its own tonight. So if I disappear halfway through this, one of you guys is going to have to finish this. I'm streaming from my phone at the moment. My Wi-Fi is completely gone. But anyway, yeah. So I think the topics that I've been discussing at the moment is probably perfect for that question, because I've been, as Brian was mentioning earlier about trying to change the narrative, I've been trying to have men introduced into the conversation of eating disorders and body dysmorphia, which is other known as body dysmorphic disorder. And it's just like they're topics that usually get associated with women. So when I've been bringing the topics up, people can't believe that there's a man actually discussing these topics. And I think a lot of the time men will get overlooked because of that. So I think when people talk about eating disorders, they usually will think of like anorexia or bulimia, and they usually have like maybe a young girl in their, as the image that they have in their head. But like men suffer from these things too, and there's lots of different types of eating disorders as well. So for me, it was binge eating disorder, and that came from body dysmorphia. So if people aren't too familiar what body dysmorphia is, it's like it's a mental health condition where it's you're constantly worried about how you look, and you're constantly worried about how other people perceive you, and it's constant, and it's mentally and physically draining. And that's what led that caused me severe anxiety. This anxiety caused me depression, and that kind of led on to the eating disorder. So like to answer your question about the stereotypes, it's just something I've been trying to change the narrative at the moment by sharing my story with so many people, is to just say that men suffer from these things too. And I have been lucky that a lot of people have picked up on it, but it's still not enough. It really isn't. I mean, like as I said earlier about my social media channels, kind of I get a lot of messages, and a lot of the messages that I've been from men, and they all kind of say similar things, where they all kind of like thank me for bringing these topics up, but they all kind of say the similar things where they can totally relate, and they've lived with these, the body dysmorphia and the eating disorder as well, but they've never spoken about it, and they've never told anybody, because of the stigma. And I think that's a very important point to make, is the stigma with men and these particular topics. There seems to be a massive stigma, I think, in mental health in general, but especially for these two topics. There seems to be a massive stigma there. And like I've spoken to nutritionists, and I've spoken to lots of different people on the podcast, and they've said any men clients they've had, one of the first questions they get asked is, can they remain anonymous? And I've had the same thing for people who I've invited them onto the podcast, and they haven't wanted to do it because they wanted to remain anonymous, or if they wanted to write a blog for my website, it's been the same thing. They don't want to put their name on it. And I think that's a shame as well. So hopefully by me at least sharing my story with these particular issues kind of inspires other people to do the same, or at least introduce the conversation,
That's fantastic. And the fact that it's such an unknown, it's not something you hear a lot about. For someone like you then, Keith, you're leading the way, and that's a lot tougher to begin with, to get that awareness out there, which is fantastic. And you're obviously doing a great job when you're getting men coming and asking you questions and that on the social media, which is fantastic. Well done.
Yeah, I get an awful lot of responses from men and women, obviously, but men will kind of, I suppose the points the men have been making to me is that they're already aware that they have a problem, which is also a bit of a problem, because I knew I had a problem for a long time, but I never said anything about it.
Yeah.
So I suppose some men have said to me, "Oh, it's only when you said that I've kind of researched and I understand it a bit more." But a lot of men have said, "Oh, I already know I have a problem.
Yeah.
I just haven't said it to anyone," and that's unfortunate as well.
Yeah. Okay. Well, I'm conscious of time. Thanks for that. Thanks for sharing, Keith. There's some fantastic questions coming in that are coming through to me here, boys. So this is like the quick fire round. I don't know what's coming, but I can guarantee you they're all good. So be on the edge of your seats. There's a question here for Brian. Brian, how can men deal with the emotion of anger positively? All emotions are important and tell us something about ourselves and our experiences. I feel anger is one that is deemed a bad emotion, but we all need to be able to feel what we do and explore that.
Yeah, that's a really lovely question, actually. And I don't think any emotions are inherently bad. Like, anger can be used as a device to be authoritative, and it's needed in certain ways. Like, if your kid is going to run off the road, you need to get angry. You need to have an angry perception about you, just to get that authoritative action over that. So, and it's the same with stress. Like, stress is often thought of as a negative emotion as well, but like, for peak performance, you need to be anxious. You need a certain level of stress. So I think it's only when these emotions spill over that they can really cause a lot of problems. So the one thing I would say is that no emotions are inherently bad. And if they are causing problems, that you are being angry for reasons that are not very rational, what I would say is that they're pointing at another problem. Like, if you're constantly getting angry, there's something wrong. They're really a signal that you need to do something. And I think when our body and our feelings react overtly in any way, it's a signal that something has to change. But that doesn't make it bad in itself. Like, it's just a signal that something isn't quite right and you probably need to address it. So there's just my main messages there that, like, anger is okay. It's not a bad thing, but just ask yourself, where is it coming from? And awareness. I think everything for me, it's sort of two things come up for me tonight: connection and awareness. I think awareness is the holy grail. And when you shine the light of awareness on your thoughts, your feelings, your emotions, be it anger, be it stress, whatever it is, and you look at that objectively, mindfully, in the present moment, there's growth within that, and you can get some more awareness of why you're doing what you're doing. And for me, awareness is the catalyst for change. It's the first start of change. So just really try to get that bit right and recognize that no emotions are inherently bad. It's more of a signal.
Thanks, Elijah. Thanks. Well done, Brian. Next question here is for Keith. Hi, how can I help someone who doesn't want to speak with a therapist? He is on meds for almost a year and is particularly low recently. When he is low, he says he doesn't want to be better. Tough one.
It is a tough one, yeah. I mean, I suppose everybody is different, and I suppose you have to be very careful as well, don't you? I mean, a lot of people, they need to do things in their own time as well. What I would say, I mean, if I want to speak for, maybe my own personal experience with that, for a long time, I didn't want to speak to anyone because I didn't realize that I had a problem. So I suppose kind of maybe realizing that there's a problem there in the first place, but also sometimes it takes different types of medication for you to find the right one. It certainly took me at least 2 or 3 different types of anxiety meds for me to be comfortable with them. It's the same with a therapist. It took me 4 or 5 probably to find the right one. So that could be an issue as well. But yeah, it's very, very difficult, isn't it?
Mm-hmm. Yeah, you have the important thing about encouraging them to stay in touch with the doctor, keep on the medications, and then he says when the person is low, he says he doesn't want to be better. So it's a tough one. It's a tough one.
It is a tough one. Yeah, I think Brian might be good at answering that question too.
Yeah. Something that I'd add on to that as well is like some things are just inherent. They're just out of our control. And one of the things that's outside of our control, generally speaking, is the actions of other people, even if it's a young person in your life as well. So it's very hard to change other people, next to near impossible. But what I would say is nearly the worst thing you can nearly do is tell them what to do. Because if you start lecturing and telling people what to do, they'll put the guard up. I think the best thing to do is really to listen. And if they're willing to speak, listen, or just let them know, here, if you want to talk, listen, but listen with understanding, not be ready to respond and react and tell them what they need to do. Be there fully and listen. But something else that you have to get right as well, and I get this with a lot of people where they're saying, what should I tell this person to do to fix this thing in their life? And I'm sort of looking at that person and they say, right, there's a couple of things that you probably need to fix in your own life first. So why would anyone listen to someone else that's struggling with other stuff and they're being angry and they're like, look after your own house first is what I would say there. And I'm not saying this person, I don't know this person, I really haven't a clue of that situation. But if you're in a position where you're there to listen to someone that's struggling and you're looking after your own mental health, people will tend to come for you and seek advice. And it's not a great answer, but that's probably all that you can actually do. Like there's no magic wand there to get someone to do something. So listening is probably the key there.
Yeah, I agree, Brian. Yeah, listen.
Okay, thanks, boys. Thank you. The next one is for David. Can you ask David what he feels can help to get through asking for help without that feeling of that in itself, it is a sign of weakness or failure? Especially when I always put on a front that I can deal with anything. It's causing me more anxiety and stress to go to the doctor and maybe get a diagnosis. Thanks.
Thanks, Bill. I suppose for me to ask for help was a really big thing. And just thinking off the cuff here, for me personally anyway, it came to a desperate place. So desperation kind of, I suppose, overrid all other kind of fears, and being exposed as less than a man. I suppose it wasn't feelings or things like that were that made me ask for help. It was actually a situation I ended up in. It was the kind of behaviors I was engaging in. It was the kind of dangerous place I ended up in. You know, I ended up owing money to some delightful characters. And recovery has allowed me to fix all that, by the way. You know, I was able to clear the decks and everything like that. But I guess it's just about accepting where you are maybe, and just realizing that, you know, how would I put it? Kind of, what's the worst that can happen by asking for help? You know, that reaching out. And trust me, like, and I don't mean to sound preaching or anything, but there's things on the far side of that. There's things on the other side of that you're not even aware that you have already. You'll find amazing qualities, skills, lovely things about yourself, you know, once you make that breakthrough. That's been my experience anyway, you know. I know you have had, like, sometimes I'd still meet people from past life who may find themselves in early recovery and all, and I find myself almost threatened still by that. God, what are they going to think of me? Like, you know, here I am talking about how I feel and stuff like that. But, you know, I just see the benefits far outweigh being stuck in that place. So maybe take a risk, a positive type risk. Find someone you can trust, and find someone you're comfortable with. Maybe it's someone you don't even know. You know, go to some, like, there's plenty of kind of opportunities, you know, to reach out and get support. And you don't even have to know the person. It could be over the phone these days. Actually, just in terms of, like, and just go back to Shane's presentation and the piece about suicide, you know, I got through, dragged myself through addiction for 15, 16, 17 years. Would never have come across suicidal thoughts. It was actually in that age category that I found myself really considering. Actually, suicide became an option in my head, and it was scared the life out of me, like, you know. And I remember sitting down ringing the Samaritans, and because I took a break from NA at this time, and the difficulty, I sat in the car for an hour. I didn't want to make that call, because once I made that call, it almost made it real in my head. But, you know, once I did, like, you know, things changed, and I was able to get help for that. And I have a great support structure now as well. So just push through that, maybe just say, what the hell even. I know that sounds a bit flippant, but sometimes that's what it takes, you know. Just take that chance and take that bit of a positive risk. I hope that helps.
Could I just add
that
something
sounds
there?
great. Yeah, Shane?
I think sometimes as well, like sometimes when you're not feeling well, you have some days that you feel a bit better and some days where you feel a bit worse. And it's those days that you feel a bit better that you should be thinking, right, what can I do? How can I build my walls now that on the day I'm feeling worse, that you've started to make those connections. So even if it is ringing the Samaritans on the day, actually feel a bit better because, well, you started to practice it now. So when you aren't feeling well, you know what it's like. You've already kind of done it already. Or even making those connections and friendships or joining a new club or something when you're feeling well, because when you're not feeling well, you've already started, you know. So sometimes it's not about when you get to crisis point, you know. If you can do it. You know, I heard someone say as well, you know, upstream, downstream approaches. It doesn't matter if you're in the stream, get them out, you know, as well. So just. I'm
gonna move on here, boys. I know you're looking to get in there, David, but there's so many good questions coming up. We'll have to do all this again. A question for Brian. I'm recently back from a relapse and my mental health is really bad. Are there any suggestions in the first couple of are there any suggestions in the first couple of says you'd recommend doing?
Yeah, so I was never in that boat myself. I did have a minor relapse, but it was messing around with solving and stuff like that. I never actually experienced I was back in full mode. The one thing I would say there, so I don't know if they're back in the depths of addiction or whether they've relapsed and they're back in recovery per se. But what I would say, and a lot of my PhD research was looking into this as well. Now, I'm not going to tell anyone that's struggling, oh, you need to practice mindfulness. You need to do that because when you're in the depths of it, it's very, very difficult to access that kind of stuff. But what I would say, if you are in early recovery, your mind is going to be playing tricks with you. Like it's like the devil and the angel sitting on the shoulder. Maybe you should use, what's the point in recovery? What's the point in this? Maybe I should just do drugs. Maybe I'd be better off on drugs. And these are the kind of thoughts that you have. And there's lots of different cues and triggers that can trigger you back into addiction. You can have external triggers, whether it's walking past the pub, whether it's seeing old friends. It could be internal triggers about fear of the future. And all of these triggers can really drag you back in. So what I would say, back to awareness again, is an ability to catch those triggers, to catch yourself getting emotionally hijacked. So whether it's going for a walk in nature, whether it's journaling, whether it's talking to friends, whether it's just sitting with yourself in solitude, just try to build some awareness into your life to catch those triggers. And it's something that Shane was talking about there. I love that idea. He was talking about the walls and building the walls when you're in a good space. So I think that's the time when you really have to work hard at that. It's like building self-care capital. So like, let's say you're flying at 10,000 feet on an average day. When you're having a bad day, you're at 5,000 feet. But if you work on your self-care and you go for the walks, you reach out to people, you practice meditation, you practice gratitude, you're going to lift yourself up to 15,000 feet. And when there's a bump in the road, you're not going to come crashing into the ground because you've built that recovery capital. So what I would say to them is do whatever you can, put the work in and take action. I personally didn't do a 12-step program structurally, but I remember going back to the Rutland Centre and looking at the 12 steps on the wall and saying, I'm kind of doing that in another way. It's really just a program of action. And that is really the key. I have a feeling David might have something nice to add on to that as well.
Thanks, Brian. Great listening to there. I suppose just as you described the 12 steps, that's kind of how I've done them really. I've took the best of NA and, you know, sometimes something of a model of recovery will work for you and other things maybe not so much, but the first few years of my recovery was characterized by relapse. So I'd get 6 months clean, then I was relapsing. And the one kind of emotion or feeling that comes from all of that was shame. And maybe shame was already in me, but I was full of shame and full of failure. And I remember finding it really difficult to get back to the support group I would have found, or the peer support group I would have found. And that in itself, like, and of course I had it all wrong. Like I was thinking, they're all judging me now, you know, I went back using and stuff like this. And really hard on myself. So I needed to soften up on myself a bit. And also most people, all of them probably were just happy to see me back, you know. So it's kind of like the head. I think Brian's catchphrase, if you like, was things might be bad, but not as bad as your mind would tell you, like. So I think that comes into play. And just do yourself a favor and you know, and get back on the journey. Like, it's not about perfection. you know, all of these things we learn from them. I definitely learned from my relapse. I wouldn't, you know, shout out, go and get relapse, like, but I definitely learned from all of that. And I was able to become aware of what, as Brian said, the triggers that caused the relapses. And it served me well in later life. Using drugs is not even an option now, you know, touch wood. So.
Lovely. I'm just conscious, boys, that we're starting to run out of time. So I've one last question that you all have to answer in one sentence. That's your challenge. What advice have you got for the next generation of men coming up after us?
Right. I'll start off that. It's not really one sentence. I'm just going the end part will be one sentence, Bill, but I think it's really important to recognize what's important in your life, whether it's connection, family, mental health, realize what's important. And what I would say is feel your feelings, talk to other people about your feelings, but make decisions based on your values. What is actually important to you? Don't be making feelings-based decisions because they can be bringing you down a dark hole. So think about what's important and try to make your decisions based on those values. Use it as your North Star.
Lovely, lovely, great advice, Brian.
Well, yeah, it's a tough one, isn't it? But I suppose, well, that's already one sentence, isn't it? But I haven't started yet. Don't sweep everything under the rug just because you're a man or male. Don't sweep everything under the rug. Like, you can share, and there doesn't have to be a stigma there. Full stop.
Oh,
brilliant, Keith. Clear, good advice. Thanks. Next, David, you're
I would say don't underestimate your own strength as well, your inner strength, and you know, just explore life, explore recovery, explore your journey, or whatever you want to call it, and you'll be amazed at what you might find in there. Amazing stuff. There is one quote I'd like to use. I don't normally use quotes. It's a quote that stuck with me by Winston Churchill. If you find yourself going through hell, keep going.
And that's a man who knows all about the black dog.
Yeah.
And Shane.
Yeah, I think mine would be the man you are or you want to be, not the man you think you should be. And as I suppose moving just a tiny bit outside that, like, you know, some people might be struggling at the moment, but this sentence always rang true with me. And one guy said it when I was interviewing him once, and he just said, change is hard, but you have to keep knocking on the door, and the journey of 1,000 miles starts with a single step. So just try and, you know, reach out. And yeah, just finish there, I suppose.
Okay, fantastic, Shane. Boys, that just went far too quickly. If you were to ask me, what did I get more out of, Champions League this time last week or tonight? No comparison. What we talked about in the last hour and a half is what the real stuff in life is made of. And what's fantastic is that your talks and the advice you were given to people there who put in questions, you all know what it's like to experience difficulties with mental health. So you know where you're coming from, which is great. And it's a privilege to have you all share your struggles in life as well as your successes. And you're all very successful in your own fields. So a huge thank you to Brian, to Keith, to David, to Shane. And could I thank you, Shane, as well, for that excellent presentation earlier, looking at men's mental health. It really was clear and very interesting. I want to thank Martin Brogan, our CEO, who kicked the whole thing off at the start. Thank you, Martin. A big thanks to Georgina and Carmen, who is in the background and put a lot of hard work to bring all this together. So thank you very much, ladies. I would like to thank the co-production group who helped plan the webinar. And we will leave you with, I think we're going to leave with a few quotes from our panel, and also then a slide with useful support organizations connected with mental health and men's mental health. So that's for the first time in my life I've managed to keep my time right on things, which is great. Thank you very much, lads. And I really got a lot from that. it really kind of helped my mental health there, which was a challenge. So thank you, and thank everyone, of course, thank everyone that listened. I hope you got as much out of that as I did, and who knows, we may look at doing something similar in the future. So all the best, goodbye everyone, and thank you.
Thanks, Ben.
Bye-bye, thank you.